Angus Taylor, the New South Wales Premier Mike Baird has proposed increasing the GST to 15% to cover an expected blowout in health costs. What do you make of his proposal?
Look, Chris, the first thing I'd say is I think it's putting the cart before the horse. So the critical issue here with health and education expenditure is to work out how much money we really need to spend. And what we have seen historically and what some are projecting is phenomenal growth in health and education expenditure, which no amount of tax increases are going to be able to cope with. You know, Australians want lower taxes, not higher taxes. And if they believe that government hasn't done the work necessary to contain growth in spending, then they rightly should say, go and do that work first and then come back and tell us how much tax we really need to pay. And by the way, we prefer to pay less tax rather than more. And I think that's the right way to think about it. There is an enormous amount we can do to contain health spending. I don't see any discussion about that. No discussion about that. And that's very disappointing.
So the experts in the state just say, look, expenditure on health is set to blow out because of ageing population, more expensive drugs, more expensive hospital treatments, new technologies, scanning technologies, whatever. And the point they make is, you know, there's not a whole lot of discretionary spending in hospitals because people don't choose to go to hospital.
Well, Chris, I don't believe a word of that. I mean, technology makes things cheaper, not more expensive. Look, in 20-odd years working in management consulting, you know, my job was to work out how to drive productivity. And I tell you what, we haven't done in health what has to be done over the next decade. We just haven't done it. I mean, technology offers enormous opportunity to contain expenditure, not to grow it. We've got a system that is driven and rewards activity, not outcomes. You know, why aren't we having a discussion about how we can actually get better outcomes, not just more activity in health? We assume in this debate that more activity equals better outcomes. Well, let me tell you, it doesn't. When a doctor signs a script three different times over 3 weeks, they haven't actually helped the health outcome. What we know is that a great deal of the inefficiency in the health system falls between the cracks between federal and state governments, because the state governments look after the hospitals, the federal government looks after primary care. We need to be having a discussion about how to fix that. And then we come back to tax. I am appalled as a taxpayer, as an Australian, and as someone who cares deeply about every Australian who fights hard for every dollar they can earn, that tax reform has become tax increases. I mean, this is just all wrong, and let's start at the right debate, which is to how to provide more efficient, better government services, and then come back to how much tax we need in the most efficient way to generate that tax.
Now, the Prime Minister, Tony Abbott, has described Bruce Baird's proposal as very sensible. Is your understanding that that's really the Prime Minister's position, or is he just being, if you like, conciliatory before this leaders' meeting?
Well, there's no question. If you just put aside, you know, we confuse two things here. We confuse tax increases with tax reform. They're not the same thing. I think the Prime Minister is right in saying it would be good to see some tax reform. It would be good to see more efficient taxes and reduce less efficient taxes.
So just to pick you up on that, so would your position be that, look, a 15% GST could make sense, but in order to reduce other taxes, not to fund further expenditure on things like health?
Yeah, and I think that's a good discussion to have. But let me tell you, Chris, the discussion we're not having that we need to have is about how to contain the growth in spending. This is not about cuts. This is about how to contain the growth in spending. Look, health worldwide is undergoing an extraordinary revolution, and you've talked about some of the things there. You know, countries all over the world are using new technologies to deliver better health outcomes. We know we can avoid putting people into hospital every time there's a problem. We know we have monitoring mechanisms for people's health emerging now that we hadn't even dreamed of 10 or 15 years ago. All of these are an extraordinary opportunity for us to actually generate better health outcomes without cost blowouts. Let's have that discussion. Let's have the discussion about how the states and the federal government can work closely together on this, which is all part of the federation debate, a really critical debate to have. Independent of that, we can talk about what is the most efficient tax. But when the whole thing becomes some kind of Trojan horse to raise taxes, I've got to tell you, as a Liberal and as someone who believes that Australians work very hard for their incomes and that many are struggling with rising cost of living, that is the wrong way to go about this debate.
So if it is possible to contain health spending, as you suggest, I wonder why the states and territories who have a shortfall in funding for an expanded health spending, why aren't they doing it? They don't have the money at the moment, and this isn't a coalition Labor thing, this is all the states and territories.
Sure, because it's hard, Chris. Because it's hard. But, you know, government has to do hard things. I came into politics, you know, I could have kept going in the private sector. I was, you know, actually, in many ways, a much more rewarding career, but without the potential to have the impact that I could in the public sector. I came in because I believed that we were getting this kind of thing wrong. You know, you can talk to anyone who's worked in organisational reform, change management, business consulting, and they will tell you there is enormous potential to contain health spending, but it is hard. And, you know, Mike Baird holds himself out as a reforming premier, and I think he did some just fantastic things in the lead up to the last election. And since then, here's another chance for very, very important reforms in how we deliver better health services whilst containing costs.
Okay, Angus Taylor, thanks for your input today.
Thanks, Chris.